Please welcome Chiquita Brooks-Lasure, former CMS administrator and senior fellow at the Century Foundation, for a Medicare checkup. And please welcome back to the stage, Brie Jackson.
Nice to meet you. Sorry about that.
Meet you.
I was so used to walking off the stage and going around and picking up my notes. So it's a pleasure to have you here.
Thank you for having me.
So first, just starting off, I guess, tell me a little bit about your thoughts about how everything is going right now when it comes to the healthcare industry, because a big part of this fight that we're seeing is over programs like Medicaid and Medicare when it comes to this fight that we're seeing on Capitol Hill. What are your thoughts on all of this happening right now?
Well, just to take a step back, when we left to office at the beginning of January, I'm incredibly proud of what we were able to accomplish during the 4 years of the Biden administration. We entered this year with the lowest uninsured rate in our nation's history, with having, for the first time, negotiated drug coverage at lower drug costs for the Medicare program for the top 10 drugs. We had states expanding Medicaid, 4 states expanded Medicaid overall, and almost all the states had expanded coverage postpartum. And then just a couple of weeks later, we really had a tremendous fight in Congress about many things, but a big portion of that was healthcare. And $1 trillion was taken out of the healthcare world, which has had some serious ripple effects, even though many of these provisions do not take effect today. And what, over the last couple of months, we have seen across the nation is that the money that is taken out of the Medicaid and the Affordable Care Act coverage is already affecting care in this country. I've been doing a number of meetings and town halls across the country, and we're already seeing rural hospitals who are either talking about not expanding or shutting important services. In Georgia last week, a major hospital system announced that they were closing their labor and delivery wing of their hospital. And you know, we're starting to see already that hospitals and other providers are trying to absorb these changes. States are in the process of really trying to make the changes that they need to their programs. Those of you who work at the state level know that you have an annual budget and you have to think very hard about the changes that are coming down the pike. And so we see a lot of disarray in the healthcare industry and some adjustment about what this is going to mean as a result of this legislation. And then we get to today, which healthcare has become a big part of the fight over the shutdown. And as a former government worker and official, I've been on many sides of a shutdown, worrying about how I would pay my mortgage if the government shut down during the Obama administration, having to make decisions about what a shutdown looks like. And my heart really goes out to so many of the federal workers and contractors, and just what a difficult time this is.
And one thing I think is interesting that I saw that you did, because sometimes the hardest part is getting the message to everyday people that may not be part of the medical field. And I saw that you did an article in the Philadelphia Inquirer, and you wrote that the Republican budget bill that was passed over the summer sends a message to families on Medicaid: you're on your own. Mm-hmm. What do you mean by that?
What I mean is that, you know, we were moving to a place where I believe there was just a real understanding that healthcare is so much at the core of your ability to achieve the American dream, life, liberty, and the pursuit of happiness. You know, if we want our children to get well educated, they need to be healthy. We need to make sure that we are taking care of the seniors in our country. And we need to make sure our providers can make a living and stay open. That benefits all of us. And I think there's just been this year just such an attitude of adding red tape to a process. And you know, most of the conversations I've had with people over this year are, am I going to get coverage? Am I going to be affected? My kid is in, you know, has learning disabilities and we rely on this care. My kid has this set of services. Are they going to be available to me? And just true panic about what these cuts were going to mean. And this is, you know, a range of families. I don't think people all the time who don't spend all of their space understand how important Medicaid and Affordable Care Act coverage is for our overall economy. I mean, most of the long-term care in this country is actually paid for by the Medicaid program. You know, it's really about, you know, I'm Gen X, we've got aging parents and kids. Like, there's so many people who are in that phase of life where they're thinking about both ends. And Medicaid and ACA coverage really support so many of those families. And so many of the people that when they want to change their jobs at 50 or 60, before they're Medicare eligible, they want to leave their companies, start something new, you need to buy insurance. Well, it is not necessarily affordable at those ages, and the Affordable Care Act has really been just a tremendous lifeline for so many people who want to start their own businesses, and I've spent the years talking with them.
And I'm going to take a step back for a second because I feel like we put you on the hot seat the
Sure.
second you sat down. So I'm going to step back a little bit. Talk with me about some of the things you're most proud of from your time at CMS.
Yeah, I really feel, I look back on those years and feel tremendously proud about the work that we did to strengthen the CMS staff. We had a very strong team of officials who came in, and we were able to do a number of things that were incredibly important, strengthening the Medicaid program. So really trying to lift up the rules, the standards, and we've all learned a lot about how difficult it has been over the years to enroll in Medicaid, and so we were marching in a direction of trying to get states to streamline those rules. We learned a lot during the COVID pandemic of what we call unwinding as we started to do eligibility and really trying to lift the rules, not just of getting coverage, but also making sure that coverage is meaningful. So trying to work on improving access to care, because at the end of the day, that's what matters. Maternal health is a particular focus of mine and so many other people in the administration. And so not only getting states to extend coverage postpartum for 12 months, which I think is necessary, not sufficient for addressing postpartum care. Many women, particularly Black and brown women, die after birth. And just really helping to educate people on how important it is to have continuous coverage, important for moms, important for babies. And then prescription drugs is just at the source, I think, of so many families' concern about costs for health. It is not the only level of concern, but in good ways, I think over the last decade, we've seen such jumps and leaps in therapies coming to market. But as a result, I would say people are more dependent on drugs. The number of drugs that the average senior takes is rising, and it is a much bigger part of cost. And changing the benefit of Medicare Part D, the Medicare drug benefit, really is a lifeline. This year, thanks to the work we were able to do with negotiation and changing the benefit, the cap is $2,000. And just the time that I've spent with people across the nation, how important this is, not only for the seniors who take these drugs, but again for their families, you know, of not worrying about how's mom, how's grandmom, how's my aunt gonna pay for her prescription drugs?
And I'm going to come back to drug pricing, but I know several times today we've heard people talk about maternal health. So I'd like to dig into that a little bit more. I guess talk with me about some of the concerns that you have and some of the things that you hope to see our country do when it comes to this issue.
Well, what we know from our experts is that something like 2/3 of the maternal deaths are avoidable. And that's a combination of reasons. Sometimes it's women not being listened to. Sometimes it's women not getting care. You know, we can't just improve our maternal health outcomes by thinking, like only looking at the delivery. But we know that many, many women die in the delivery room or again, postpartum, that symptoms are missed. And I really felt during my time that we had a real synergy of private and public interest in addressing that issue. One of the things that we did at CMS with the administration is having increasing our standards on hospitals, and so many private sector companies really partnered with us on that. And I thought it was just an excellent first step of saying, here we're going to have a similar set of standards, things that we're going to make sure that all of our facilities really are paying attention to, and really try to make sure that there is engagement. Again, like we need states to engage, we need the private sector, because the government doesn't deliver babies for the most part. And I'm particularly proud of it because Medicare does not deliver or pay for a lot of the babies in this country, but hospitals and other providers care what Medicare cares about. And so I thought it was just wonderful to be able to use the Medicare program, which it often is, as a way to drive changes in our healthcare system.
And returning to drug pricing, we know last week the Trump administration announced that Pfizer will charge most favored nation pricing to Medicaid and guarantee pricing on newly launched drugs. What's your take on that?
So I think that it is a bipartisan agreement that how much Americans are spending on prescription drugs is too much. There are a whole lot of reasons that we don't have time for and different points of view. So I think it's good that we continue to look for ways to try to make sure that people can get access to the drugs that they need. I think I look at the announcement and I think that is not sustainable for your whole life cycle, right? Like if you're a person and you're taking multiple drugs, you need those drugs, all of them, whatever you're taking, to be priced in a way that you can, where you're able to make sure that you can pay for your health care. So I personally think we still need to look at comprehensive policies to make sure that prescription drugs are affordable, because we all know that we're in a country where innovative drugs come to market, but if people can't actually afford them when they need their care, what's the point? And healthcare costs, prescription drug costs are not sustainable for our various programs.
And with new leadership at CMS in place now, which of your policies are you most concerned about? And what bipartisan areas do you expect to endure?
Well, what I'm mostly concerned about is the coverage. And, you know, I think that H.R. 1 has moved us in completely the opposite direction of putting so much additional red tape that what we have seen time and time again is when you add red tape, people who are eligible lose coverage. It started, you know, the CHIP program, that's how I got started in my healthcare career, where adding more burden on children to prove that they were born in this country led children who were born in this country to lose coverage. And that's one of my biggest concerns, that, and even though these things seem fast, the other thing is, you know, adding more red tape to both to Medicaid and ACA coverage. And I really worry about the health of the marketplaces if we make it so difficult. There's many of the things that we did during our years are what led us to go from 12 million to 24 million, and taking away those things administratively as well as the changes that have come in legislation, I worry that we'll get back to where we were when we started.
And so now you're with the Century Foundation. Can you talk a little bit about your role there and then how you hope to make an impact on the industry in that role?
Well, mostly I've been spending so much time talking about all of the things that are happening in healthcare. Who knew, that this would be such a busy year, and how much people really need to understand what's happening. So a lot of what I'm doing is really making sure that people across the country really understand and think about how they can use their voice, because none of these changes are inevitable. They are all decisions, and as more and more people understand the implications, hopefully we will see some changes to some of the policies, and really thinking about what do Democrats look for the future. I think there's so many things that I would have loved for us to be tackling this year. You were talking just a few minutes ago about prior authorization. There is more work to be done to make sure that people have access to care. I would really like us to get back to those topics, and that's what I'll be hoping that we shift to once we get coverage back on track.
Well, thank you for your time today.
Thank you.